My name is Jacek Gonot. I'm a medical doctor specialized in trichology. Hello, hello, once again. I'm really happy to see all of you here. Since it's 4, we have to wait maybe 1, 2 minutes more for our colleagues. Since a lot of people sign into this webinar, but I think everyone is busy because the time we shift the time a little bit earlier. So regarding the organization issues, I will remove this one. Regarding the organization issues, at first I will tell you a little bit about the trichology degree and heart transplant. Later we will go into the talk about the diagnostic methods. You will have to occasion to talk and to learn during the studies. And on the end, please post all of the questions on the chat. We will go to the chat on the end to have it also the recordings of this webinar. So we will wait 1 more minute and we will start. Since if you have any questions for now regarding the masters, we have also here some coordinators from recruitation, so you can post the questions down here. We will talk also together about them. On the end, you will have also some contact address, so email, directly WhatsApp. If you would like to talk by the phone with someone, just feel free to call. If they will not answer, they will for sure call you back. So, guys, 1 more minute and we will start the. Um, what else? I know the screen is little bit shifted, yeah, up, but it's because I have the PDF of this. If you would like to, we can later send it to you. It's not any problem. So once again, everyone, welcome. My name is Jacek Gonos. I'm medical doctor. I'm doing my internship from oncological surgery, working also in trichology and hand transplant field. I'm from Poland, Wrocław, and I'm working only here from time to time. As you can see today, I'm cooperating with Amir. I came for the first year for English division of trichology to the Madrid. Since before it was only for Spanish students, and I really like it. It gives me a lot of opportunities in my work to change the daily oncology surgeries also for something which give you this more smile, let's say. And that's the reason why I'm today with you, and we would like to talk a little bit. So, as you know, Trichology Master and the degree is created for 1 year of studies. You will have access to the online platform, and you will also have a weekly training in Madrid, which is intensive week, as it's mentioned, but it's really intensive. So you have to be aware of it, because it's from 8 till 8. Yeah, so that's the case. So let's have a look for all of this stuff we have here. So. What about the trichology and hair transplant? Probably some of you are from Europe, some of you are from different continents, countries, maybe more far away. Um, in Europe, there is a high demand, and the sector of trichology grows in the last years. Yeah, patients caring more about themselves, caring more about a look, yeah, image, and that's the reason why also the trichology is a really good field of medicine to go into. Yeah, as you have the aesthetic medicine, there is also trichology, also the laser therapy. Yeah, as a huge field. Uh, what is the trichology? Yeah, from trichos, from Greek, is a study about the hair. And basically, thinking about the name of the studies, yeah, trichology, hair transplant, you're thinking about, okay, we will do the transplants for males only, but that's not true. So it's offer you much more, especially the diagnostics, treating of the patients, treating of the skin conditions, treating of the alopecias, redensification of the hair, and much more, also related to the females. Yeah. So, uh, What else? As you have mentioned in this slide, yeah, the economic profit. That's probably the thing why most of you are here? Yeah, because medicine is also our work. Yeah, we want to have money from it because we work hard. Yeah, it's different type of work, but it's also important for us. And if you have your own clinic already, you work somewhere, you have opportunity, you have time, you have space for it. It's great to fill the space. Yeah, to do not lose money, to do not lose patience, to offer something else to your patients. Yeah. And speaking still about the master program, so the trainings is really designed by the professionals. In Spain, trichology is in really high level. A lot of medicines, a lot of diet supplements, a lot of topical skin drugs, per oral and other stuff compared to Poland. A lot of specialists, yeah, since the hairs are only not in the head, you have to be just to know that the hair transplant can be also done in different parts of our body, like in the eye area, yeah, eyebrows, for instance, or in males, just the breath, yeah, in case they, let's say, burn them. That's the one of the thing. So, speaking about the format, so it's really nice for people who are working, who are active in in work, because you have access to the platform 24/7, and that's great. You can study anytime you want. You have still some exams to pass, and you can pass them anytime you want. Of course, on the end, you will have the master work to write, to choose a topic, and then someone will just check and follow your summary of this year. But that's not that hard. Don't be worried. It's just focusing on that what is inside, because there is that lot of material that I'm working in trichology in about 3 4 years currently, and I'm still going back to them. They are really nice prepared for you, so that's really great, really great opportunity, to have it something in English, which is the language of medicine right now, and you can every time you want just be back. Yeah, and that's what I think is beautiful really here in Amir, speaking about trichology, speaking about the aesthetic medicine, because you just create the for yourself the possibility to work internationally. Yeah, some of you are young, some are still young, and the thing is, maybe in 10 years you will change the place of your living, and you will have occasion, yeah, to work on it. So this is also something that you pretend your money source for a future. Yeah. So, going to the next one, of course, medical trichology, as I said, yeah. So we have the holistic approach, so diagnostic of medical trichology, alopecias, yeah, all of the types in males, females, post-trauma, because it's also happened, cosmetic treatments, speaking about the cosmetics, how we prepare the treatment plan, how we prepare the medical plan of treatment, and of course, the follow-ups and support of the patient. The thing is, here you will also have occasion to work with PRP, so platelet-rich plasma, to work with peptides, which are injected by the mesotherapy in the hairy head, and also lot of different stuff. And the practice, yeah, and the surgical techniques also. They are at first on the let's say oranges, and also some special mannequins, just models, fake models, and then you will have really the surgery, and you will see how the whole process just look like. So this is not only, the patient is ready, you have everything, you just have to prepare everything. Yeah, so at first the patient come, you have to draw how you want to prepare the hairline. Then you have to remove the hair, yeah, since we know the transplant is done on the hair, which is approximately 5 7 millimeters, yeah, because it's easier to work with the grafts. um and what else? The thing is, is a great adventure, great opportunity. And still speaking a little bit regarding the masters. So you will get also the ECTS. So for people who are studying in Europe, maybe for some of it's important, yeah. In Poland, we have to show that we gain the points, because that's meaning that we are still improving our skills. Yeah, it's approximately 8 months. It depends what time you exactly sign in. As I mentioned, the nice flexible format, yeah, and the practical training. In real, the 6 0 hours, sometimes it's more and sometimes it's much more. It depends. The teachers are open for you for your questions in the future. Me, as I start, because I start to work with the let's say holistic non-surgical trichology. After 1.5 years, I decided to perform the transplants, because you need to time. You need time. If you want to do it in your clinic, you need to prepare papers, talk with the lawyer. At first, the most important thing, train your team, because to post in advertisement that you are looking for the team of the hair transplant technicians, it's almost impossible to find anyone. Yeah. And also the expert team. Yeah, there's really here the persons which will you meet. There are nice experts from Madrid, not only from Madrid but from the Spain. Most of them you will recognize from the online platform, and later you will meet with them. Great opportunity every day. You will sit with when there is a break to the meal and talk with them, and this is completely different feeling that in the typical school. So there's really, let's say, individual possibility to have the connection with a teacher, and later if you will need anything, as I have from time to time any need to any just to talk and consultate, it's possible. So that's a great idea. Here just a quick look for the alopecias, for the trichology as the modules, yeah. Um, it's something like a Netflix of of trichology. Many hours, many hours, many hours. You can also hear them during when you ride a car, just to have a voice, just to memorize, because there are also, if you're working in medicine, any field, some new vocabulary which you have to recognize if you are not a native speaker. Here just a quick look for the theoretical classes. And this is Claudia. She's great. Hopefully you will have occasion to talk with her. So yeah, the introduction, just general talk, alopecias, yeah, so scalp pathologies, because as a hair is a derivative of the skin, we have to work on the skin, huh, all the time. And other androgenic, yeah, the biggest problem every country with androgenic alopecia. Unfortunately, we are working faster, we're living faster, we eat junk food, and that's all our environment. Yeah, epigenetics just have a impact of us. Of course, genetics, yeah, as well. Yeah, if the son have a alopecia, of course the father will actually the father have the son also will have. But it's here we don't have any patterns for general treatment. It's rather individual. So that's important in this work. Medical therapy, yeah. So there will be some movies and procedure which are important and done in everyday practice when you work in trichology. So capillary mesotherapy, low laser therapy, also therapy by red light, PRP, steam-based cells, also nice. Oral supplementation, other treatments, pharmacological aspects, yeah, the anesthesia. Why anesthesia? For surgery, yeah. You have to know that the lidocaine have also the toxic levels, and in case you will do anything in higher doses, it will be not that good for our patient, and we don't want to have the arrhythmias on the table due to the too high level of anesthesia. That's the reason why later is mentioned the basic and advanced TRP and other emergencies. This is also, I mean, the procedures are talk when you are in Madrid in real time. So that's really good because we are just studying how to do things good, but there are not any talk about the emergency, about the critical situations, about the situations in case you will just lose a control. And as everyone, me, you, and your friends, your coworkers will react by as a big stress, yeah, and that can create a disorganization of work, and later will be problem, yeah. Going to the five, yeah, the surgical treatments, therapy, of course, the graft, yeah, we have different techniques. That's important. All of them you will see. All of them you will see. The technique what will be the performed in the patients, it depends from the doctor that will do the transplant, but on the technical trainings in place on Madrid, you will see all possible techniques which are, yeah. Of course, the consultations, communication with the patient, yeah, since uh, sometimes not all the grafts, sometimes even half of the grafts will stay in the skin. I have occasion to see from Poland many people go to the Turkey, and the thing is they not care about the hair transplants, the just the grafts after, and there are huge alopecias. And that's really important to know how to talk with a patient if you are not working in psychiatry or oncology to, not scary them. Because for some of males mostly, yeah, the hair is something that gives them ego, yeah, and just the masculinity. So the thing is just to know how to talk and what to say and what not to say, and the other aspects of transplantation, of course, yeah. You will get also the special documents, yeah, because in the study materials you will have the PowerPoint presentation, you will have the pre-record videos, and you will have also the books. Let's say that there are small books with the chapters, yeah, and with the pictures. Really useful. I really recommend you it. And of course, the groups are really small. Mostly it's six, sometimes four, sometimes eight. It depends, people. Uh, and yeah, it's really nice. From time to time, you will have opportunity also to see other extra webinars with the guys. Which are teachers there. So it's something like some extra. The university just gives something extra, so it's really great. Yeah. So once again, you will have a just division of the days into it. So yeah. Here you can see the small device which called a trichoscope, yeah, or digital microscope. You just check the hair under the microscope, check the hair, check the skin, the quality of the skin. There are special rules for evaluation of the quality. Um, the thing is design, so the drawing. Yeah, the important is our head is like a globe. It's completely different when you draw in a paper and then you will go into the head because you have to work just in a circle. Yeah. Uh, Techniques in real patient, you will have the donor area, recipient area, the anesthesia. One day you have to also something like a stimulation of emergency situation uh, with CRP, and of course the real patient training. Um, Yeah, and going to the topic of today a little bit, to speak about the diagnostic methods. Regarding diagnostics, so you will have opportunity to to work and to diagnose also yourself by the trichoscope. I have it here once. Maybe you can see of them. This one is we've connected by USB. It's just a normal one. You can buy them just everywhere almost. How much is cost? About 100 euro. It depends how good quality do you want. You have here also the buttons for zooming, for snapping, yeah, if you want. You can also add the pictures to the history of the patient. Some of them are without, with battery, just, yeah, without the cable. The problem is that they are heating really fast and the battery lasts only about hour or two. So it's up to you what you prefer to use. Sometimes it's good to have this and this because it gives you opportunity, if something happened, the battery will be discharged. You can then use the cable one. So you will have opportunity to work with the imaging methods. Yeah, that's the thing. Important, speaking about the diagnostics, pictures and everything in the same place with the same light as in aesthetic medicine. About the diagnostic methods, yeah. So this is like imaging. Do we have any other imaging methods in triology? Yes, generally you can do the test by Wood's lamp, yeah, UV lamp, also to looking for any fungi infections, yeah, and bacteria. You can use what else? Different light colors just to reflect how the skin looks like. Let's say if we're speaking about psoriasis and the scalp. But this is the really long story. You will know more from the documents and from the study program. Other thing, diagnostic methods, of course. So we have the blood test. Blood test, huge topic. Huge topic. Why? Because at first, uh, alopecia, androgenic, non-androgenic, can appear in males. Yes. Can appear in females. Yes. What else? Vitamins, minerals, folic acid, B12, zinc, D3, ferritin, ferrum, of course, thyroid, yeah, sugar, insulin resistance, other many possibilities. Um, so speaking about the diagnosis, it's really a huge topic. Also, the tri-hop patient is a specific one, since most of the blood tests we need to carry, they have to be paid by own patient. Yeah, they are not refunded from any insurances in Spain and in Poland by any clinics. They have to pay for them. So sometimes the package of a trichology costs about 200 euro, yeah, for beginning, plus the visit, plus the drugs for beginning. So uh, the patients are also the specific patients, yeah. They want to care about themselves. Uh, is the treatment of trichology patients easy? In my opinion, no, especially if we're working with the chronic skin conditions. There is not only talk about the usage of steroids in different doses and different time of working. It's mostly about how you can impact on the patient and the behaviors and habits. You know, diagnostics, it's also the talk with the patient, yeah? Imagine we talk with the patient asking how often are you washing your hair? Yeah, 3 times per day. Okay, so why 3 times per day? Because I'm training, they become more oily, and in the evening I want to have a fresh for morning. Yeah, some of the people are using not correct shampoos. Yeah, some of them are using dry shampoos too often. Some of them are using too hot air when drying the hair. Yeah, and if you add all of these conditions, diagnosis is really hard in the patients who are swimmers, yeah, because they use the caps. The cap is a problem since we produce the tractions. Generally, all of the works who need to carry the anything on the heads, yeah. even the protective helmets, even the caps, yeah. Um, it's really hard. So diagnosis is a huge topic. Of course, so we can just do a quick dividation of the methods. So we will have the imaging and non-imaging. Yeah, that's the simple just for a beginning. And from imaging one, you will have micro and macroscopically. So macro is that what you are seeing by eyes. Yeah, you just see and you can say something about this hair. Okay, from 1 meter of distance, I see that they are not that dense. Yeah, I see the gaps between them. Yeah, you're going closer, half of meter. Okay, I see something moving there. Happen from time to time. And then you have microscope, yeah. So this device which can be useful and it gives you big satisfaction to doing it. And then you will have other different, yeah. So non-imaging. So the chief complaint and the blood test if necessary. If not, then you just have to send someone to the dermatologist if you are not dermatologist. Yeah, it depends. Since in trichology, it's a division of medicine which connects the dermatology, connects a little bit of aesthetic surgery. I would say also the internal medicine. I know it's funny, but you know, if you have to talk with a patient and then you realize, okay, rheumatoid arthritis, young patient. 28 years, male, insulin resistance, taking methylprednisone. Okay, and losing hair. Okay, and then you go into the next. So this is, more deep, and you have to go more into the talk with the patient than only checking and prescribe the drugs. Yeah, of course, we have a lot of universal things. Universal speaking about the minoxidil, speaking about uh, the topical steroids, as I mentioned, yeah. But this is not everything. Of course, we have to ask about the diet, if there is any exclusion, yeah, of the diet. Vegan, vegetarian, vege ovo. It depends, yeah. It's give you, or of course, if there is any diet, because some people eat only, pre-ready food, which is the junk food without any macronutrients, yeah. So we going to the next slides. So pre-transplant designs, yeah, the anesthesia, as we mentioned, dermapen and microneedling, yeah. So that's the a little bit confused since we cannot do microneedling in the area where it's already the hair. Why? Because if we have the hairs, yeah, they're growing, and we will pinch them in a different direction, then we will just disrupt the units. There will be no effect. There will be the opposite effect that we want. So the microneedling is only performed in the areas we would like to have a hair, yeah, as a stimulation of the skin. What else? Corticosteroid mesotherapy, yeah, for chronic inflammation. Okay, and yeah, on the pictures you can see here how the boys are working. Uh, the device for taking the grafts. This is not a needle. This is a device for taking the manually the grafts. And the oranges. Why oranges? Because they are just spherical, yeah, and that's easier to work on them. Do we use the fake hairs? Yeah, fake hairs and they are black. And this is also important here when you learn. There's the ink for staining the orange because orange is yellow. In our head, when you pinch them, you can see the blood, yeah, and here just to get it easier to put them inside. That's using, yeah. So what else? What else? Yeah, some pictures from real OP room, yeah. And here you can compare different types of glasses, yeah, with the loops. Um, Here is our best teacher from Korea. She's just the best. It's like a maniac to doing it. Of course, there are different one. Yeah, the surgical one. Here we have the classical, which are more useful and give you less, let's say, stress to your hair. Yeah, since you need to work some hours and have it on hair, on head, it's easier to work with that type rather than this one. Yeah, and of course, the price is, I don't know, 20 times more, probably. Yeah. So giving going to the summary, here you have all of the informations. Yeah, the best is to contact, of course, by WhatsApp if you have any issues, or you would like to ask anything, any problems during registration, during with documents, questions regarding the study program, anything. I will send you here, and just giving the summary of the topic of diagnosis. So the diagnosis of the methods. It's not that easy, yeah. In my opinion, working in oncosurgery, we have procedures for everything. We have protocols for treatment of giving diseases, yeah, cancers, supportive therapies, other stuff. And trichology is little bit like dermatology. Why? And why it's connected in some countries with it, because it's mostly treating of your skin, of your scalp. Yeah, and that's the thing, mostly. Yeah, mostly, since okay, you have some burns, you have different problems, folliculitis, chronic folliculitis, post-traumatic, alopecia, you have some scars. It's a huge topic. It's impossible to talk about everything in that short time. So I just leaving you with this message from today from my side, and I'm going to have a look. Yeah, you will see me right now. Just going to have a look here on the chat. That do we have any questions? I see it's something here. Okay, we're going from a beginning. So from a beginning, I have a question from Sabrina. Yeah. So I'm studying. If I studied medicine, but I still don't recognize my diploma in Europe, can I do this course? So the thing is, please, we will contact with you here on the Teams, and one of our coordinator will contact with you and will answer you for these questions. Uh, just to have a look on which currently moment of recognizing of your diploma you are. Yeah. Okay. So I think is the best possibility to deal with this problem. But I think it will work, but they have to check it. So don't be afraid of it. Next question I have from the and Sabrina, please tell me if it's fine for you. If not, please write down. I will answer to you from Sar. Um, if there is, just give a moment. Okay, if there is any practical options, how are you training for during this course? Yeah, there is practical. Yeah, of course, in real patients, and you will work that long how you want, since it's time consuming to put the grafts into the hair head. So yeah, you will work, and you will have a lot of time for taking and putting them into the real patient. So yeah, that's it. And the good thing is also, if there is a question of some of you, the insurance is provided for the university, so you don't have to be afraid of any extra additional costs of it. So that's the thing. Do you recommend any brand? So Elizabeth, could you more specify the question? I mean, you recommend the brand of what? Of this one? It was the question regarding the diagnosis, or because if we're speaking about yeah, for the Trichoscope. So generally the thing is uh, about the brands. To be honest, in Europe, generally most of them are just like made in China. Yeah, some of them have a brand which is only local, like in a country, but what you have to look for is that the price. If you have anything for a price which is lower than, let's say, 55, 60 euro, even in Amazon, it's not good quality. The good quality trichoscope starts from about 100 euro, 100, about 200, and that's fine. You don't need the stuff from for 1,000. It's nonsense here. Yeah. So speaking about the recommended any brand, even Mile are not. They're off brand. They are just off brand. They are not directly shipping from China, but they're off brand. But I'm satisfied from them. The same, the people who are working in this Spain, they don't have them any brandish, because if you take anything what is with a brand, the thing is they cost lot of. I mean, 2,000 euro, 4,000 euro, and that's make not any sense. Only what is the only difference? The only difference is that in some countries, like let's say Swiss, I know also in UK is this thing. You need to have something with certificate, yeah, to just pretend it as a diagnostic method for medicine. And some of these expensive brands offer you the certificate. So that's the thing what you have to look when you look for the brand. So that's the answer of from my side. So I see we don't have any other questions. I hope you like it. You spent almost hour with me. I wish you a nice evening. And as I mentioned, if you have any other questions, any stuff, yeah. Mm, okay, I'm see Elizabeth. I'm also just answering in a moment. If you have any other questions, just the contact with us. Um, Master clinical dermatology. And Elizabeth, did you done this one in UK? Because I know the program is in UK. Okay, yeah, so it's possible. It's possible. It's the same question, yeah, like Sabrina. Just contact with us and they will provide you all information you have to do. But yeah, it's possible. Of course, it's possible. So we will do the same with you. Yeah, to contact with you. Okay, guys. Wish you a nice evening. Hopefully, see you in Madrid in November. Yeah, in November or October this year. And if you have any question, I'm also open for them. So anytime something will go into your head, just feel free to ask. Thank you very much and see you. Bye bye.